Hi, the current online slideshow is about mindfulness-based cognitive behavioral therapy in COVID-19 pandemic and other psychological techniques to stay healthy during the pandemic. The current COVID-19 pandemic has generated global fear and concern in everyone. In many people, the reactions have been those of anxiety, fear, uncertainty, and depression. The major causes are the interruption of our social networks, social isolations, and the possibility to look to others in moments of needs and solitude. Besides, in the case you need psychological support, this last will generally not be provided during face-to-face encounters with your doctor or psychologist. What you can do? I created a current video with some useful psychological tools for self-help in the case you want to help yourself deal with the emotions and worries linked to coronavirus pandemic. These strategies do not substitute your family doctor or any other mental health professional, and you should look at their advice if things are not going well in your life. The cognitive behavioral therapy model is an integration of several factors, including the environment, for instance, COVID-19 lockdown, social isolation, interruption of jobs and studies, with physical reactions like pain, palpitations, weakness, moods, depression, fear, anxiety, thoughts, I will die from coronavirus, conspiracy theory, and behavior, agitation, restlessness, lack of energy, problems with sleep. What is mindfulness-based cognitive therapy? Mindfulness refers to cultivating and controlling awareness by focusing on ongoing thoughts, emotional states, and impressions. Mindfulness-based cognitive therapy derives from the Buddhist tradition and the Sanskrit word dharma, representing neutrality. Mindfulness indicates meditation that leads to awareness as a profound and non-judgmental perception of the nature of mind and the world. What are some of the causes of worries during COVID-19 pandemic? During the coronavirus infection, we assisted to lockdown, increased social isolation, and reduction of social encounters and face-to-face contacts with mental health carers and others. All these aspects increase the likelihood that people have more time to ruminate about their worries and the lack of social support and lost opportunities in their life. Mindfulness-based cognitive therapy addresses two aspects that can occur in people's mind. One is ruminating and thinking obsessively about their worries, and the other is evading and repressing unpleasant thoughts, emotions, and experiences. Why focusing on worrying is ineffective? Linked to worrying is the fact that any effort to avoid focusing on the causes of worrying and the effort of evading worries paradoxically increases the probability that you will focus on whatever maintains your worries. Mindfulness consciousness helps people to be more versatile in their thought processes and to perceive their internal stress events as natural responses and fundamental facets of self. Mindfulness techniques during COVID-19 pandemic. The 7 pillars. Mindfulness comprises 7 basic cognitive approaches to your worries, which can help you have a better quality of life during the current pandemic. The first pillar is a non-judgmental approach to feelings, thoughts, and experiences. Do not try harder to combat your stress, fears, anxiety, and worries. You should acknowledge that they represent natural reactions to what is occurring in the current moments. You are not going mad, but taking any form of action to actively combat these feelings can only reinforce them. The second pillar is patience. Do not hurry to find a quick fix to your emotional problems linked to feelings of isolation, lockdown, and worries. Please accept that there is not much you can do to change the progress of coronavirus. However, you can use proactive social strategies to keep yourself and others safe and without stress. For instance, seeing others while maintaining social distances, participating to communal activities while wearing protections, visiting family members by keeping social distances. The third pillar is novice approach. If you feel worried, tense, agitated, restless, or with no energy after the beginning of the pandemic, and if you have no symptoms of coronavirus infection, these are normal emotional reactions. They will not stay there forever. With a simple mind of an explorer, just acknowledge them and look at them with curiosity without doing things to avoid them, but leaving them as natural experiences. The fourth pillar is developing trust. You should develop confidence in your feelings and emotions and not to combat them as they are not really how you would like to feel. During COVID-19, people might become fearful of consequences and isolation and try hard to make some dramatic changes to the way they are reacting emotionally. These efforts paradoxically can reinforce the emotions you are trying to reduce. The fifth pillar is make no efforts while become aware of events without anticipations and ambitions. Any effort to prevent unwanted thoughts or feelings make them more intense and enduring. During COVID-19 pandemic, some people started to be worried that emotions and thoughts would not change. They anticipated the worst. They started doing something to change things, with the result of having more hassles in their life. The sixth pillar is acceptance, refers to accept things as they happen in the current moment. Things evolve naturally. Emotions, thoughts, physical reactions to COVID-19 are new experiences for everyone. Historically, meditation is also founded in the Chinese philosophy of Tao, of letting things flow as they are, which is referred as Wu Wei wisdom. The seventh pillar is letting go, means that mindfulness refers to accepting things, not promoting and discharging them. The being mode means developing awareness and acceptance with a non-judgmental attitude and curiosity on the occurring experiences with no efforts to change them. There are other general strategies of cognitive behavioral therapy. One is identify your maladaptive thoughts. For instance, focusing on negatives. Oh, I will never be able to go back to work and study is the end. What is the action? You should test the validity of your thoughts. For instance, recent lockdown was lifted and many returned to their work or are still working from home. The other is jumping to conclusions. Oh, I will never see my friends again. The action, again, is to test the validity of your thoughts. For instance, by maintaining social distance, you can still see your friends. The other one is overgeneralization. All people of my age always get the worst condition after coronavirus infection. Again, the action is to test the validity of your thoughts. For instance, it is not the age but those who keep in a good physical health that have better outcomes. Another form of maladaptive thought is catastrophizing. Oh, I have lost financial assets and I cannot find a job. Test the validity of your thoughts. For instance, you can use this additional time to work with job centers and build new skills to face the job market. The current online tool represents one strategy of self-help while you are at home. If you feel that your psychological worries do not improve, you should look for help from experienced professionals. Thank you for using the current online mindfulness instruments. Here you find some useful references. Here you find some useful references.